All right, this is a quick review of the reproductive histology slides for big picture anatomy. Remember, when you're doing this, be sure that you use our wish list available on the website, where you can take a look at all of the specific structures that I would like you to know. There's not a whole lot of them. The histology of the few features of the ovaries, of the uterus, the testes, the vas deferens, the spermatic cord, and the penis. If we look at what's available in the PAL program under histology, the reproductive system, this is just a slide of some sperm. It's a smear where they just have speared the sperm out across the slide. This is showing them a little bit more close up. See the head and the tails of the sperm. And even closer up, the sperm, the head, the tail, what's called the midpiece, which is the mitochondria are located. This is now seminiferous tubules in the testes. If we look at them close, then we can see that there are sperm being formed around the walls of the tubule and pushed out into the center or lumen of the tubule, even closer up. And you can see there's this, the spermatogonia, the cells that divide to start forming the sperm, what are called primary spermatocytes, eventually spermatids, as they are break off or are loosened into the lumen or the center of the entire seminiferous tubule that's been cut across there. This is, remember that the sperm are forming inside those larger sustentacular cells, and it's pretty hard to identify, but those are the nuclei of the sustentacular cells that have the developing sperm within them. And there, that's actually a really nice view of a, except that it gets covered and shaded out when I go across it, but that whole thing is one seminiferous tubule, and you can see the nuclei of the sustentacular cell. You can almost visualize one of those cells right there outlined, and the progression of the sperm as they start out of the periphery and move towards the center of the lumen of the tubule. Just another view of the same thing. Sustentacular cells holding the developing sperm in their walls as they move towards the center of the tubule. There we can really see a close-up of what that looks like as the spermatogonia, or the sperm-forming cells, give rise to primary spermatocytes, and eventually those spermatids that break off or are released as sperm into the center lumen of the tubule. Yet another view of the same thing. All right, this is an ovary where you can see varying stages of follicular development. So remember, we've got this space that where inside the follicle is called the antrum. Here you can see a mature tertiary follicle. So that's one that's where the oocyte is kind of suspended there in the middle of the antrum. And this would be a post-ovulation follicle that becomes what we call a corpus luteum, with that kind of crinkled look to it, all out in the cortex of the ovary. Here's again, there's a secondary follicle, so it's not inside the antrum yet. There's an open antrum, and there's a primary follicle becoming secondary. So you can see different stages of oocyte development. There's a nice, oocyte inside the antrum, another oocyte inside the antrum, basically, mature tertiary follicle. This is a close-up of the antrum showing the zona pellucida and the corona radiata around the oocyte, the antrum itself. More follicles in the ovary, not a great slide, I don't think. There's a nice up close of what an oocyte looks like, so, as it starts to develop into a secondary follicle in the follicle. Okay, another a really high close-up of the follicle itself. There's kind of a mature follicle with the oocyte in the middle, the antrum around it there. That zona pellucida around the egg with the oocyte. Oocyte, zona pellucida, the corona radiata, all in a nice antrum of a very mature tertiary follicle. More of the same in this slide. And more of the same with just an up close of the oocyte itself and the layers around it, the zona pellucida and the corona radiata. This is up close of a corpus luteum, where now you no longer have an antrum. The cells, the granulosa cells become kind of convoluted like that around the outside. Almost seems like it's collapsed in and on itself. It takes on that shape. Post-ovulation, that's, again, a close-up look at that. Don't have a lot of that on your wish list. Again, another close-up look of the corpus luteum, very easily identified by that kind of folded look to it. Yet another look at the corpus luteum. We're looking at the corpus albicans, which is the corpus luteum that starts to disintegrate and gets sort of resorbed back into the ovary by the macrophages. Another view of that corpus albicans, and yet another. I'm not even don't have a big focus on that. Here's the uterus in that proliferative phase, where you see a lot of uterine glands as the wall of the uterus is to be built up, the endometrial lining. The myometrium is the muscular wall of the uterus, and you're starting to see that endometrial or internal lining. It's going to get filled with these glands, and eventually, proliferative secretions from those glands in the form of sugars and proteins to support a potential developing embryo. And again, that's what those uterine glands look like in the wall of the uterus. Here we're starting to get a secretory phase where those glands are actually secreting proteins and sugars. Probably a little bit hard to exactly tell the difference. This is the vagina with it's got a stratified squamous internal lining of the vagina, so it's like they've cut along through the wall of the vagina, and it's basically like involuted skin, stratified squamous epithelium, just with no outer keratinized layer. Another cross-section of the vagina showing that stratified squamous epithelium. Close-up of the stratified squamous epithelium of the vagina, and yet another view of that. And that's pretty much it for the reproductive histology slides from PAL. So that's it for reproductive histology. Just be sure you're using your wish list when you're looking at the slides.